Well, here in Nigeria, the second wave of the coronavirus continues to surge as the National Center of Disease Control is confirming a further 1,617 cases. According to the latest data, once again, the biggest number of infections came from Lagos, which saw 776 cases, followed by Kaduna State with 147 cases. The latest information means in total, the country has seen 112,004 cases. So far, 89,939 of those have been discharged and 1,449 have died.
Now, the resumption of schools across Nigeria amid the second wave and the spike in the cases of the coronavirus is still a subject of debate. While the government says it is not aware of the concerns and has made proper plans to contain and prevent the further spread of the virus, stakeholders worry that the situation is a time bomb waiting to explode. Joining us to put the situation in proper perspective is a Nigerian professor of virology, Oyewale Tomori. He was the regional virologist for the World Health Organization Africa region. You're welcome, Professor. So would you share, thank you for joining us. I was going to say, would you share the sentiments that the return to schools is a time bomb waiting to explode?
Yes, I do. I do very much. I think we've had the children at home. They're not going to come together. I'm not too sure we have the preparations to maintain the non-pharmaceutical interventions, safe distancing, everybody wearing masks, washing of hands and water supply and all those things in our schools. It may be available in some private schools, but generally in many of our primary and secondary schools and our university system, we don't have the wherewithal to ensure that the non-pharmaceutical interventions are complied with.
Prof, what would you have wanted or what would you have loved the government, both at the federal level and the state level, to do instead of reopening the schools and having them go back to school? What would you have wished for?
All the time that the children are being at home, not just the government, not the state government only, but even the parents themselves. To ensure that all those safe distancing, other things like that are complied with in the schools. And until those conditions are satisfied, no person should be allowed to go back to school.
But some have argued, Professor, that the best training ground is the schools themselves, because and some have also argued, in addition, that copying and pasting the strategies of the Western world does not necessarily apply to Africa. A lot of our students or a lot of our population are poor. So some of these instructions are better taught in an organized environment like schools, where they can be reinforced with role modeling.
Yeah, of course, I agree with you. But then you have to create the environment for the training. You can't lump 200 students, 300 students in one little classroom and say you want to train them how to do it right. No, you set up the system where that safe distancing, the next desk to the next person, or you reduce the number of students that are going to school. There are also, we don't have to follow what is going on in Europe or whatever. There are different things. In those days, there used to be shifts in classes. You have some going in the morning, some going in the afternoon. We can adapt to our system to meet whatever it is that is done there. Nobody is saying copy what is in Europe. Use what is in Europe to adapt to your own system so that you can get the same result. That's what we're saying.
All right, Prof. Mass testings couldn't be conducted because of probably a lack of the capacity to do so. Here I have the front page of our sister publication this day. Says tests not required for schools resumption. That is government saying that. What do you make of it? Could it have been handled any other way?
You see, the whole issue we're talking about is that we know 60-80% of people are what you call asymptomatic. They may not show the signs, but some of them are positive. I'm saying that that's the reason why you need to be sure that as much as possible, the people you are mixing together are not spreading the disease amongst themselves. We do know that the very young primary school children, we don't seem to have many more cases among them, but the adolescents, already the age of 10 upwards, those are according to NCD's report, those are the ones that are actually having most of the cases. Therefore, you want to be sure in secondary schools at least that you keep those people as far apart as possible so that they don't transmit amongst themselves. These are the same students who will get it in school and take it back home to their parents, elderly ones, grandmothers and grandfathers. That's the reason why you need to be sure. What's wrong with testing them to be sure that they have? Recently, you remember in one of the Lagos private schools, they tested some of the students and quite a large percentage of them were positive, and they had to close down the school. I expect if we don't take time, we're going to see an upsurge, much more than we're getting now, with more cases occurring, especially among the young people who are now taking it back home to their parents, and then we'll begin to infect more people.
Okay, I'm going to lump three questions in one, but I think that they're going in the same direction. You talk about testing and the necessity to test, but then we've had the argument that you test today and you could contract it tomorrow because it's out there in the community. So to what extent is testing really so crucial? That's one. On the second hand, you mentioned 60 to 80% infection out there. So where are we with this herd immunity we kept hearing about at the onset of the pandemic? Have we not reached a stage where you could say the people have formed a kind of, if we're getting infected and people are recovering, that somehow some organic herd immunity may have already sprouted? And then also help us understand, some people go about talking about rumors of an innate, for lack of a better word, immunity among Africans. What does this look like? Why, to try and explain why we seem to have fared better than the West? Please help me with those three.
Good. Yeah, let me start with the testing. The advantage of the test, if you get your test as quickly as possible, it means that I'm positive and you isolate me. If you don't, doesn't mean that you take me to isolation ward. You can do your isolation at home and let people know that this guy is positive, and within the village, you keep all those safe distances. That's number one. That's the advantage of testing. Then you know that the man that is walking across the street, is a positive case. He should be in isolation, either in his home or whatever. Even if he's not showing the symptoms, that he should be in isolation. That's the first one. So you keep that person out of circulation. Now you make the point that, if so many people are infected, then the herd immunity should go up. It is not everybody who gets infected that develops immunity. In fact, the more fact that you are asymptomatic, it's likelihood that your level of immunity development will be much, much lower than somebody who has the infection. The essence of infection and immunity is that you get infected, it affects your own body system. The body then develops immunity against it. If what you have in as asymptomatic infection, maybe ending up in the point of entry, like the nostril, for example, there your immunity ends, because what you get is immunity along the lines, the cells that are affected. And because they debride off very easily because of the nature of the cells there, you don't have any long-lasting immunity. So it does not mean that because many are infected, therefore all of us have herd immunity. The only way to confirm the herd immunity is to do a study. In fact, we are planning one already, which is going in which we are collecting samples from different people, whether you have had it before, would they check, have you had it before, did you get to hospital, did you do that? And then we see what the immunity development has been. In addition to that, we're looking at serum that have been collected way back before COVID came in. Is there something in it that is making us to be protected against those from outside? We speculating, we don't know. And until we do that kind of study, in which we take samples collected like 3, 4, 5 years away from the COVID and see how many people have either antibodies to COVID or a related COVID virus, before we can say with confidence that, we are protected because, we have had previous infection with something related to COVID or not. Until that is done, it's all speculation.
All right, Prof. My colleague, Femi, on Saturday said she was a little bit worried that most of the publicity on COVID-19 has been centered on adults and nothing at all has been done for children, concerning protocols and what have you. What's your sense about that?
In a recent publication, which actually this morning, which NCDC presented, they showed the pyramid of the different population age groups. And what we had was a middle balloon of adolescents, people from the age of 15 and above to about 45, were the ones that actually are showing the largest number of people infected in the country. People at the tail end, that is from maybe 10 years downwards, and people at the top end, maybe from about 55 and upwards, are not as infected as that middle group. However, in terms of severity, it is those who are at the top, the elderly people, who are dying out of it. So these are important information that people to know. Younger people, maybe like from the young people from 1 year to about 5 or 6 years are not that being infected as much. Those who are above them by 50 to 60 in terms of number are not being infected enough. The major people who are infected are those around age between 55 and say about 15. But then the severity of the infection is more in the adult, and that's why we're having more older people dying of the disease. So I think this important information is very important to know that, yeah, the young people may not be spreading it. I mean, that's the one below the age of 10 or thereabouts, but that above the middle age group, I mean, we call the middle age, 10 years and above, so that people are the ones who are busy spreading the thing all over the whole place. And we must take note of that one, because then they infect those who are older people, who then get a more severe infection than they are getting.
Okay. All right, Prof, we're going to have to keep you on pause. We'll come back and we will continue with the discussion. You're still watching News. Stay here on Arise News. We'll be back in a bit with more. Don't go away.
You're watching Newsday, and we're still with Professor of Virology, Oyewale Tomori, and we're engaging him with regards to the resumption of schools and the implications in the midst of the second wave. Professor, I just want to ask, again, for the sake of emphasis, a lot of people have queried whether the blame allocated to schools and even to churches with regards to the spread of the virus hasn't been inordinate, especially in the context of the fact that we had the Yuletide season and a lot more socializing. So should the emphasis, I know you explained earlier, but just for the sake of emphasis, should the emphasis not be on training people to stay safe within schools? Because the cost implications of taking them out of schools is exploitation, as people have said, whether sexual or otherwise, and then the drop in their education exposure.
Yeah, thank you very much. I mean, in a country where we have good development, I mean, the same system that we have in this country, the private.
Okay, so yeah, I mean, it's a topic that's been very widely discussed in terms of people have data to back the fact that a lot of students out of school are being exploited sexually, and otherwise some are even getting impregnated because they're around and they're not in a safe environment. So this is something I would hope you will talk to. Professor, please carry on.
Yeah, I was coming to that. And I was saying that if we had spent our money in developing world, we won't have this situation where this children are roaming and all that. Days come around, pregnant days. Some it's been but why would anyone assault a young girl or something of that nature? These are things we're used to. It's not the matter of COVID.
All right, yeah, you were saying something. Yeah.
Yes, and he had started trying to respond to that. He was trying to say that maybe it's a function of our civilization that people see a child that is outside school as prey, because there are indications and there's data to back the fact that child exploitation has risen since the children were left at home. So a lot of people are arguing that even if it's just for their safety, they should be in schools, not out of schools, because they're more vulnerable out of schools. You know.
Well, it's like saying between two devils or being...
the devil and deep blue sea.
The devil and deep blue sea, yes. I mean, because the question of COVID-19 is deadly as well as what you're talking about. I don't know about that data, but it's neither here nor there, really. It's neither here nor there. You just don't know how to handle. But let's go back.
Okay, let's see what the professor has to say. Please go ahead, Professor.
Can you hear me now?
Yes.
Yep. Yes, please. Sorry to say that. I was saying that even when in school or out of school, I mean, sexual harassment will still continue. Teachers, mess up with their students. Parents mess up with their own children. All those kind of things. So that moral decadence is is just being brought home to us now because COVID is bringing all of us together and it's not giving us those opportunities. So what I'm saying is that if we had spent our money properly, if instead of, take a good example, Tetfron goes around the whole place, buildings that are dilapidated, abandoned after some time to contractors. If we have put that money into developing technologically most of our children will still be studying right now without having to be locked up at school. So we are paying for our underdevelopment. We are paying for misuse of our funding. We are paying for all those past years of profligacy that we're getting involved in. Now is the time for us to see what lesson can we learn from all of this one. How can we move forward into the better? How can we learn from the experience of the past that has brought us into this decade, just like you said, this deep blue sea and the devil or whatever it is? Can we get ourselves out of all these ones by spending our money properly, using our money well? This country was at one time producing vaccines before. Why are we not producing vaccines now? These are questions we'll be using this COVID opportunity. It looks like a disaster now. To me, it should be an opportunity for us to make our country better than what it was. If it was good for my generation, it should be better for the current generation. And that's what I'm saying. What did we do wrong in between my generation and this generation? We need to address it. COVID is opening our eyes to see that one. And let us take advantage of that.
Well,
I hope you got what I said.
Yeah,
yes,
well,
we did.
The schools are back. The government stuck to their plan. Now, the question of monitoring to know if schools are committed really to enforcing these protocols. There's the danger, you talked about this before, the danger of these kids, picking up or contracting the virus, one hopes not, but then pass it on to their parents when they get back home. So that question of monitoring and making sure that the protocols are enforced, what's your sense of whether the schools will be able to keep up with that or not?
Thank you very much. Now that we have decided that they must go back to school, we must be ready to do what is necessary to protect them while they are there. And that means it is not just for the government alone, not meant for the state alone. This is where I talk about the parents and the teachers to get involved in it, to work together with the government, to ensure that whatever it is the schools need, is it to get them a better system for washing their hands on soap, for example? Is it to get tests done, then getting all the people who are involved with testing, working with the state government, working with the federal government to make sure that these children are tested as often as possible, so that if you find any case as quickly as possible, you take that person out of circulation so it doesn't spread to other people. You use the word eternal vigilance is the price of liberty. And liberty from COVID is going to be eternal vigilance. It's not what they say, the parents to say, oh, the children are in school, that's the end of the story. No, the children are in school. We must monitor what is going on in there. We must see them on a day-to-day basis. We must check them when they come back home. We must see what is happening to them in those places. That's what parents need to get involved in right now, not just the government alone. Now that they're in school, then what can we do to solve the problem? In other parts of the world, when they've gone back to school and children have had this in, they have either had to close the school or give the proper isolation for the children. We should not just abandon it to the government and say, now they're in school, that is all. Our parents are now to come out openly and come out and get involved in whatever is happening. Monitor these children, test them as often as possible. If anyone is sick or shows positivity, take them out into isolation and make sure that you protect the rest that are there. And when they come home, make sure they wash their hands. Make sure they are wearing their masks so that they don't bring in disease into your homes. Everybody must be vigilant, including parents, teachers, government, and the students themselves.
Indeed. Prof, looks like the president took your advice. He's wearing a face mask. I hope you're seeing it. You said that on the program that the president should start wearing face mask. Looks like he took your advice. Thank you so much, Prof. Tomori there.
I'm very glad about that. It's our role model. So we should use it. It should be an example for all of us.
Thank you so much. Thank you for being on the program, Newsday.